So I think we're live finally, and had to change the time a few times because we were trying to get it perfect, but I think we're there now. So what do you think? How you been? So I'm seeing a lot of questions. All right, so let's take a few of your questions. Someone talking about healthy living. And so here's my thing. I think in order to make your life perfect, you got to get into some great habits. You got to understand what your genes, your family history, your medical history mean. And then you got to figure out the way. I would say paramount to that, diet and exercise are critical. But also, we've talked about this in one of my videos about sleep and sort of some of the other things which you and I have been looking at. And then I think the main thing is look for happiness in everything. Be positive, because life is good for every single one of us. What do you think? All right, let's look at some other questions. Someone wrote me, let's see here. I'm looking at all your questions, trying to figure out some. Someone's talking about hair loss and hair fall. Great question. I tell you what, why don't we do an episode on how the hair grows? Would that work for you guys? Would that help you? Meanwhile, there's some other interesting questions out here, and things. So someone just asked me, Aditi asked me, can diabetes be cured permanently? So for now, what we can do is two things. One is we can make you diet controlled and basically change your habits and your exercise. But eventually I envision that to be possible, where we either transplant pancreatic islet cells or alternatively give you an artificial pancreas. Now, in the case of people with type 1 diabetes who have no insulin coming out, those patients have bigger issues. And in the case of patients who produce no insulin and they're having an insulin pump with sensing, actually works pretty well right now. By comparison, a type 2 diabetic is managed by other things. And I would say that if you can mitigate your diet as well as take care of the exercise, your diabetes will go down. And part of that will be making sure your weights and everything are well managed. All right, let's talk about some other things. Aniket just asked, does running extensively in younger age weaken your knees in older age? That's a great question. Everyone's different. The cartilage in your knees is only made once, and for now we don't really have a great way to replace that cartilage. So the struggle people have is as they get older, that cartilage degrades with that degeneration, you end up having bone on bone, and that's when you start to have pain. The treatments for the lack of cartilage and bone injuries and all that are not great. Injecting hyaluronic acid or putting in cartilage because it's not vascularized does not work that well. And honestly, by the time it becomes bone on bone, we oftentimes will replace the knee joints completely. And that has been shown to be beneficial in patients with severe osteoarthritic changes or bone on bone where they can't walk. But even that buys you time, because if you're very aggressive with your activity, those artificial joints can need re-replacement at some point, but they last anywhere from 10 to 15 years, depending on how active you are and what you're doing. And the operations are fairly safe these days. So to answer your question directly, as long as you're not incurring a lot of injuries and you're wearing good shoes and running on stable surfaces, in many cases you will not necessarily have issues. The time it becomes more of an issue is if you're tracking a lot of miles, or alternatively you're mouth tracking with your knees and you're getting pain and whatnot, there you should see a physical therapist and or an orthopedic surgeon and have them kind of evaluate your gait, your shoes, and where you're running. And I think in doing that, you're going to be well served. All right, let's turn to another one. How to control our blood pressure. Madhuri Lovers asked that. And so blood pressure and high blood pressure is very, very common. In fact, one study showed as much as a third of the population or more can have it, and oftentimes it's silent, and it's silent as a killer. What it ends up doing is it's like creating a hill which you have to climb every time you want to pump the blood through the arterial system. And there are many things which can cause high blood pressure. Some of it is genetic, and in the kidneys, there's a very intricate system along with the carotid arteries and part of your brain, which regulates that blood pressure. But what can happen over time is it doesn't work very well, or due to certain electrolyte imbalances or other things, you can have perennial high blood pressure. And so in those situations, you have to step in, because every other end organ which is seeing the high blood pressure, including the heart, the kidneys, and the end arteries elsewhere in the brain, can actually be affected by that. So the first step in blood pressure is a lot of the things that you're doing anyway for healthcare, like controlling your weight, sometimes controlling your salt intake, and sometimes putting you on medications. And the idea is to go to a physician, be monitored. The second thing is getting the blood pressure meters in your house so that you can monitor whether or not you are seeing it in yourself. And so it's a complicated answer, but I think it's a good place for an episode. Now, I wanted to ask you guys, I want you to tell me what you want to hear about and what things you think would help you in your life and kind of help you figure things out. Are we hitting the right things, and are we doing the right episodes for you, or are there things which you guys want to hear about which I'm not covering? All right, so you can leave them in the comments below. Let's see, what else are we talking about? There's someone who asked how to deal with severe period pain. I'm the first to tell you I'm not an OBGYN, but I can tell you along the way, as both a general surgeon and a doctor, you do see a lot of patients with that. And severe menstrual cramping is not an uncommon symptom, and it can be managed by various things. If it happens repeatedly or even happens without your periods, you need to see an OBGYN, because there could be other findings which could be treated. The most simple solutions are with non-steroidal anti-inflammatories and things like that. Depending on what the issue is, and if you're getting excess bleeding and excess pain, sometimes they have to put you on hormones in the way of BCPs, birth control pills or whatnot, which can regulate your cycle a little better so you're not bleeding and whatnot. And then further, if you're still having that, they have to look for endometriosis. They have to look for other reasons you would have this. And so I would say if it's happening persistently, we need to get you into an OBGYN to do a proper assessment. All right, let's see. What other questions do you guys have for me? I guess, how effective are multivibrants? What a great question. It's interesting because most people who have balanced diets probably don't need multivitamins. Now, I know that the multivitamin companies are not going to say that, but I'm telling you that if you were to measure all of these different components for macro and micronutrients, my guess is you would find that most people are pretty well balanced if their diet is balanced. The trouble comes in if you're on any type of diet, or alternatively, if you are fasting or doing other things, Or in the case of vegetarians, for instance, they tend to have low B12. And so in those cases, multivitamins are a benefit. Alternatively, if you've been diagnosed with anemia or some particular type of condition, pernicious anemia or low iron anemia or whatnot, in those cases, specific repletions to your vitamins may actually help you. But in most cases, if you do have a balanced diet, you probably don't need vitamins, um, and you'll be fine. Okay, let's see. So Vikram is asking about his mom with diabetes who has pain in her legs. Vikram, it's a great question. As a vascular surgeon, we would deal with this. There's two types of pain diabetics can get, and the interesting part is in type 2 diabetics, long term, you frequently can have loss of sensation and neurologic deficits in a stocking glove distribution. What that means is it's like wearing stockings on your legs or gloves, and that numbness can actually lead to injuries to your legs, which you don't even sense. And hence, in diabetics, they already have poor wound healing, and they have issues with their vasculature, and so they can get ulcers. But when someone has pain, there could be several other things going on. One could be from neurologic reasons. The second could be from poor blood flow. And then the third could be from wounds. So I would say if she is having pain, I would have a neurologist see her. I would have an endocrinologist see her to make sure her diabetes is well managed. And failing those two things, they can do different types of tests to see what the root of the pain is, and subsequently kind of figure out what would be the appropriate approach. All right, moving on. Someone is asking why they might have pain in their legs with a change in weather and when it gets colder. You know, it sounds like something which could be an old wives' tale, but the truth is, during pressure changes and whatnot, some of your joints can be affected, and in particular in arthritics, in people with osteoarthritis, you can have situations where your joints hurt with cold weather or with changes. And the interesting part is, it's not unreal. In most cases, you have to find out why this is occurring, meaning that if you have arthritis in your bones or in your joints, is there something in particular which you need to do during these periods of cold weather or whatnot? But what I would start with is trying just socks and warm pads and things like that to see if that improves things. And then move from there. All right. Mega asked me, can diabetes be reversed? And I spoke about that already, so you guys can fill her in. Someone asked about a great diet with traditional food, and it sounds like a vegetarian diet, but they still are having digestive problems and constipation problems. It's a great question. Generally, so two things. One is, I spoke about this on one of our YouTube episodes on constipation and things you have to worry about. Look, you can still have constipation even if you have enough fiber on board, because fiber is one of the elements. You got to make sure that you're drinking enough water. You got to make sure that there's no other underlying digestive issues in the way of problems with wheat or with celiac sprue or with other things. But I think barring the normal stuff, I would ask you to go see a gastroenterologist and just do a basic workup to see if there's something else. The simple treatments over the counter, as we described in the video, are going to include increasing your water intake, using fiber in the way of docusate sodium, in the way of Metamucil or any type of other fiber. And then you can also use stool softeners. If that's not effective, I would recommend that you do see a gastroenterologist so they can make sure that there's nothing else going on. All right, next question. I have hepatitis. You think that's why it happens to my leg? Sorry, can you clarify that? Someone's asking, what is the procedure for treatment of varicose veins? So it's a great question. Varicose veins occur because the valves in the veins in the legs fail. And due to that, then when you stand up by gravity, all the blood flows down into the veins and engorges these veins. When those veins clot off, you end up getting pain. Alternatively, the blood can seep out of the veins into the surrounding skin and cause horrible ulcers. And so varicose veins are not just an annoyance or a cosmetic problem, they can actually be a health problem. Now, how can you avoid them? If you're on a profession where you are standing most of the time, wearing compression stockings, which keep the veins compressed, will prevent the veins from engorging and the blood to flow out. If alternatively you've developed varicose veins, there are treatments now which can deal with them, including laser closures and radiofrequency closures from inside the veins. From a cosmetic perspective, you can also inject them with foam, basically agitated saline, which will cause them to clot, and then just wrap them. You can also take them out, and that's what we used to do in the old times, but nowadays we close them with radiofrequency or with lasers from the inside. But it's a great question to ask. Okay, someone just asked me how to keep your heart healthy. It's a continuum, right? And you are absolutely right. I spoke about this to the Economic Times the other day, that heart disease, by and large, is the #1 killer of Indians as well as people around the world. There's 17.9 million people who die of it a year, 80% of which are strokes and heart disease. The idea of heart disease is basically that the arteries around your heart or other areas have cholesterol deposits and fat deposits which block the blood flow, and then the areas which are getting blood flow have no ability to get nutrition and oxygen and end up dying. This results in a heart attack. How do you avoid that? So the idea is simple. You got to recognize that you're at risk for heart attacks. So who would be at risk? We've talked about this in one of my videos, but the major risk factors for heart disease are family history. If you have a first-degree relative with family history, you would have a 4 to 10-fold higher risk of having heart disease. If you're a smoker, if you have morbid obesity, if you have diabetes, if you have high blood pressure, those are all risk factors for heart disease. So now you know you have a risk for it. The second thing is, what do you do about that? The idea is to risk stratify yourself. And depending on what your exercise tolerance is, depending on how active you are and what you're eating and what your BMI is, we can then intervene and decide if you have risk factors. Once you know you have risk factors, we can work you up with a stress test as well as labs and figure out that you're at risk or not. And then the next step is, how do we avoid it? Or if you're coming in with chest pain symptoms, how do we treat it? Now, there's an episode I want to do on what to expect if you're having chest pain and how to treat it. And I think that would be really, really helpful, so that you know that you need to go in, or maybe this isn't that. But it's hard to know without examining. And so I would always err on the side of kind of figuring something out. All right, someone's asking, is there any test for early heart disease detection? The answer I've sort of alluded to here. Pia, thanks for asking. That there are tests which you can use to determine if you're at risk for a heart attack, along with the history and physical. And then the idea is, in select cases, you'll want to work those up with angiograms or CT angiograms or calcium scoring. Now, it's interesting, and I'll talk about this. I went in for an executive physical recently, and I've always had a borderline cholesterol, but as you may or may not know, the studies on the lipid lowering agents, particularly the Crestor, showed at 12 years that there was no benefit to grossly reducing the cholesterol in terms of survival benefit. However, in select cases, if you've had a history of heart disease, or you have a strong family history, or there's some other reason why you come to our scrutiny, we would want to bring your LDL down to sub 100, closer to like 60 to 70. And we would also want to bring your total cholesterol down. So the answer is, it's a continuum that if you know you have a family history, you have risk factors, you need to go in and be evaluated and be smart about it. And then the second part of that equation is, look, if you know that this is going on, you got to straighten up and fly right, because there aren't a lot of options once things happen. All right. The next question is, let's see, you guys you have some great questions. Okay. Someone just asked, Raj Curran, saying, is BMI a good way to measure body fat? By the way, you resemble Tony Stark. Gee, thanks. That's the haircut of this week, I think. But anyway, so BMI is basically kilograms over meters squared, and it basically tells you your fat density, if you will, or your density, if you will. And so, to answer your question, BMI is not a perfect tool. It's just one more indicator. And the way you calculate it is take your weight in kilograms and divide it by your height in meters squared, and you'll come up with a number. Below 24 is felt to be optimal. 24 to 29 or so is felt to be overweight, and then 30 to 35 is obese, and 35 to and above becomes morbid obese, and then 40 and above is super morbid obese. Why is that important? The original BMI study suggested that if you have a high BMI, that the risks of you succumbing to a secondary disease like heart attacks, strokes, other things in a 10-year period was much higher than the baseline population. But there's certain conditions under which BMI is not meaningful. And in particular, in people who are really muscular, who have very dense bodies, the BMI at some point doesn't matter, because muscle mass is much higher than fat. And so you may have a lot of muscle and very little fat. I would say the two other tests which we look at are waist to hip ratio, which is kind of an important way to tell and does correlate to major morbidity and mortality, meaning complications. And then the second thing which I think really helps is something like a DEXA scan, which will tell you the fat composition and also show you where the fat is distributed. And so if the fat is distributed in your abdominal region, that tends to have a much higher risk for heart disease and for other symptoms. So I hope that answers your question about BMI. All right, moving on. Someone's asked me about Tayaba Uruj, about someone, I guess they have hepatitis B, and they're asking if that's why their legs hurt when they get cold. And the answer is, I don't see a correlation between one and the other unless you've got significant issues with your liver and cirrhosis and backup of blood in your legs. But I would say that's one you need to see your doc on, because I'm not aware of any strict correlation between one and the other. All right, what other questions do you guys have? Are you all watching the cricket match today? And who are you rooting for? I know it's going to be a mixed bag, but I think sports and communal sports, bringing people together, is such an important theme. So this is one thing I was going to talk about, that if you can find workout buddies, and if you can find a sport or an activity which you're interested in, the likelihood of you continuing that is very, very high. And so the bottom line is, just don't watch cricket, go and play it. And please, be smart about it. If you are a weekend warrior and you've got risk factors for heart disease and all this other stuff, see your doc before you go and play hard, so we don't have any adverse complications. But by all means, go and enjoy your lives. Someone's asking about the best way to cure cholesterol. So it's a great question. I alluded to this in the Crestor studies, in that cholesterol in primary prevention is not as clear cut as it is in secondary. What does that mean? Primary prevention is where you reduce the cholesterol level of everyone, because the data does not support that reducing the risk of having an event. And also it doesn't support the improved survival or lifespan of people who took that. In fact, the risks of the meds that they had given, the HMG CoA reductase and Crestor and whatnot, was higher in terms of liver issues and muscle cramps and things like that. However, in patients with secondary risks, meaning that they have a first degree relative, or they've had a heart attack, or they have higher risk for heart disease, they're reducing your cholesterol is a good idea. So how do you do that? Most of the cholesterol, elevated cholesterol, results from intrinsic factors in the patient, meaning their inability to transport cholesterol properly. And that can be from a variety of reasons, not having carrier molecules, whatnot. At the same time, it's always genes and environment. And so in the case of patients who have high cholesterol, reducing their intake of certain types of food can actually assist them in reducing their cholesterol, but that alone doesn't always do it. And so it would be a combination of the two, and it should be monitored by a physician to make sure that there's no issues with side effects from the drugs. All right. All right, so I'm trying to see what other interesting questions. Someone's asked, what's the connection between vomiting and the need to pass motions usually seen before a cardiac attack arrest? I've recently lost 2 relatives that noticeably had that. So there's certain somatic things which can happen, but generally when you look at people with typical heart disease symptoms, which is about 70-80%, they're usually chest pain radiating to the left arm or shoulder, hand, accompanied by shortness of breath, accompanied by a feeling of sweatiness or diaphoresis, or shortness of breath. I'm sorry, I already said that. Diaphoresis. Additionally, you can have issues with atypical symptoms, which are indigestion or heartburn, or you can have symptoms of no pain at all. A small percentage, as high as 20%, will have atypical or no symptoms. And so to answer your question, vomiting and the need to pass motions. So if you have a complete arrest and you lose vagal tone, that can happen. But I don't see these as the symptoms which I would track for someone having cardiac arrest. I think someone going down would be the most likely thing. So Shrisha Kumar Madraki is asking about father who has diabetes in control. However, he's 120 kilos, due to which his legs have become black below the knees. Can you suggest something for better blood circulation? I can't say without examining, but I would guess that he probably also has some venous stasis, and he can also have some pigmentation. I think the first thing is to have him seen by a good diabetologist. Sounds like his sugar's in control. The second thing is to have a vascular surgeon take a look at him to make sure he doesn't have venous stasis disease, which, given the discolorations and all that, could be also the case. Now, in diabetics, also they can get discoloration as well. As long as he doesn't have wounds and things, I'm not overly worried. But when you say he has bad circulation, you need to actually check that and see. 123 Abracadabra is asking any interesting medical tech or devices you're working on or have invested in. It's a great question. I have invested in a few medical device companies as well as tech. And so what I'm trying to figure out is what is the kind of stuff where it would actually make a difference in your life. And I track a lot of variables, not just one or two. And the idea is, can you track stuff which is meaningful to you, or is it just a bunch of useless data? And I've shown you some of my toys, right? I had a Go Key at one point. I have the Apple Watch. I have an Aura. I have this. I've also invested in some heart rhythm companies and other things. I'm looking for ways to bring it all together and trying to build a platform which will use these endpoints to try to evaluate whether or not it makes a difference in your life. I would say more data is better than less, but the issue is, how does it make a difference? Because more data is not always meaningful, and if it just makes you worry more, then I have a problem with that. CD Harfale is asking me, it sounds like they had a fracture in a long bone and they inserted a rod in the leg. And he's asking, can that be removed? Absolutely can be removed if it's bothering you. I would see your orthopedic surgeon and ask them, but you need to understand why you're having it removed. If it's not causing any issues, not sure why you would want to have to go through another surgery necessarily, because it's just sitting there, it's innocuous. They're usually titanium these days, so I don't think they'll set off MRIs or anything. You might have issues in airports, but you just tell them that you had an operation and you're fine. Truck Crash is asking about some light on mild left ventricular hypertrophy and grade 1 diastolic dysfunction for hypertension, if it's possibly reversible. So the answer to that is yes, it is, by reducing the blood pressure. So generally in those patients, we will decrease the afterload, which is the blood pressure, and then also kind of tinker with their preload. In other words, give them a diuretic or whatnot. With that, what you say is the heart remodels over time, and some of that is reversible. But with years and years of high blood pressure, and remember what I said, that up to a third of the population could have it or more, a quarter to a third, and a lot of them don't know it, that you can have long-standing changes if left untended. So I think it's a good idea to examine it. Someone asked me what the expectations for today's match is. That is a baited question, you guys. And so, I'm always a fanboy for our team, but on the other hand, I just love sports, and I love the fact that people come together. And if you play a great game, my hat's off to everyone. Let's see. Someone asked me about gray hair since childhood. What are the reasons and treatment? So that's a great question. Pigmentation and hair is very interesting. I've seen people with gray hair. I've seen people with white hair. I've seen people with all kinds of variations. Look, I don't think in and of itself it's harmful, or that it's something which will cause you grief over time. But I think the main thing you have to see is, does it bother you? And you can always diet or whatnot. Are there specific solutions to that? Not that I'm aware of. I don't think that it's a negative feature. It just means that your hair is not pigmenting anymore. Are you aging faster than the average cat? No, I don't think that's the case. All right, let's see what else you guys have. So here's the other question. How are you guys feeling now? Leave it in the comments below. Do you think, one thing I'm seeing, and I wanted to comment on, was whether or not we need to all be wearing masks. I kind of debated with one of my colleagues this morning about that. And, um, he was saying you still need to wear them in restaurants, you still need to wear them elsewhere. And I have a lot of respect for him, and I don't think he's wrong. But at the same time, at some point, we'll have to accept some of this. And so I need to be clear about this, that with a vaccinated, healthy population, the risk is pretty low of succumbing to COVID now. The problem is, and this is twofold, I'm seeing a lot of people now with colds and coughs and flus, seasonal flus, because no one's wearing their mask anymore. So if there's one thing we learned in the pandemic, masks, hand washing, all that stuff does help. And so my advice would be, if you're in a very, very big crowd and you're worried about it and you don't know everyone there, like a train station or something, wear a mask. Be smart about it. If, on the other hand, you're in a small gathering, two things. One is, if you're sick, don't go. And second is, if you guys are exposed to someone, then quarantine, right? Because you're just going to spread it. So some of this is common sense, but I don't think everyone's learned it in the pandemic, and everyone is eager to go out, give hugs, shake hands, and do all that. And I don't think that's the wrong answer. But, am I wearing masks everywhere? There are occasions where I am, but I'm not uniformly doing that. And I am vaccinated and actually had Omicron in January. And I'm boosted and whatnot. And so my expectation is, could I have this again? Yeah, I could. But I'm fairly confident that I won't succumb to it. And I'm fairly confident that I'm smart enough that I won't get into trouble. All right. Kaima asked me, what's your favorite book? I love science fiction. I was talking to one of the editors of the Economic Times the other day, and I love to read. And so she'd asked me the same question. I don't want to, spill the beans, because you'll hear it all in the interview, but I'm a huge fan of Isaac Asimov. I've also read Lord of the Rings. I've read all the Harry Potter books. I've read all the Star Wars books, believe it or not, before they became movies. And then I also like to read incessantly on different topics, whether it's nonfiction, fiction, whatnot. I'm always dreaming about how we can move into the next thing. So that's it for that. Let's see, sir. Do you agree that we are underestimating our culture of Ayurveda? So, my view on this is, look, some things have been there for 4,000 years and people have sworn by them. And, I can't really argue with that. My only comment would be that it should be a collaborative effort. And I think one thing which would really help is if we were to test some of this stuff scientifically and see, because who knows, maybe the next set of meds will be discovered from our Ayurvedic preparations and help people with other things. Sir, I have a 5-year-old. Is it safe to give Pfizer COVID vaccine to him? I believe Pfizer is both FDA approved and has been tested at this point. But you'll have to check on it in the particular country you're in, if you're in the US, and see that it's there. Is it safe? Yeah, most likely it is, but you just need to see what the CDC guidelines are and what they've said to do. It's interesting. One viewer just asked, she's 26 years old, she has PCOD, and she's underweight. That's typically not what you see for someone with PCOD. Due to the hormones, they usually end up being overweight. And this is a source of, and also hirsute and whatnot. And the treatment for that generally is with hormonal therapy in some cases. But I think the main thing is, I would start by seeing your OBGYN and having them do some studies on you and figuring that out. And then you can go from there. All right, what other questions are we talking about? All right, you guys. You've asked about acne. So I've done a whole episode on acne, and I want to defer to my own episode because it's a really good one with Jay Sri Sharad. So I would say if you don't mind doing that. Someone asked that they have pain in their tailbone or coccyx. Is it serious? It's not serious, but it's literally a pain in the butt. So you can have it evaluated. You can use the simplest thing, which is a pillow. You know, when you sit down, they have special pillows for that. But I would say at least get it worked up once and see that you don't have a fracture or something else going on. And if that's not the case, then figure out what you need to do to supplement your cushion and go from there. Someone wrote, Noor wrote, that they appreciate all our efforts. You know what? I did it for you guys. And the bottom line is that I just want to start a dialogue with all of you and get you to think about yourselves for a change, and not just think about me and the world out there. And so the idea is that if we can work together, and if you see in all my links and all that, I'll always put the links to the evidence-based stuff, because a lot of times there isn't that. And so what I like to do is at least have you guys looking at all of this. Okay, what else are we talking about? Someone asked if their daughter is underweight, what tests would you suggest for her? You know, I would start with a good history and physical and make sure that we identify what things are going on with her. And then from there, before you order any tests, I wouldn't routinely order tests. Figure out what her eating habits are, figure out what issues they have, and then we can look at, you know, some of the basic things to make sure that there's no healthcare issues. Because the problem is if she's severely underweight, then that can lead to abnormalities in the labs as well. So it's a chicken or egg. And so that's where I would start. Why does diarrhea occur? You know, I've answered that in the video which we drafted, and so I would refer to that because it's actually outstanding. But in short, in the US, it's usually from bad food, and in India, it's usually from bad water, and sometimes bad food, but oftentimes bad water. All right, some people are asking, can vascular dementia be reversed? It depends on what's caused it, but usually vascular dementia is from small vessel disease leading to breaks in the flow to the brain. And when that happens, you end up having issues with higher higher cerebral function. The answer is, can it be reversed? Well, it depends on what's causing that. If it's from diabetes and things like that, sometimes it can't be if it's really late. That's an interesting question. Let's see. Here's a great question. How do you deal with a fatty liver? You know, it's interesting you should ask that because up to 20-30% of the population at any given time in certain socioeconomic ranges will have fatty liver, and most of the time it's non-alcoholic fatty liver disease. Why is that an issue? Well, it goes hand in hand with the fact that obesity is an epidemic. And so the easiest way to treat, and what do you see? What are the signs and symptoms? Generally, they'll just be obese, and when you scan their liver, you'll notice that there's a lot of fat deposition into the liver, which impairs liver function. In the worst case, when that happens, your liver can actually shut down. And it can also lead to a higher rate of liver cancers, as well as having liver cirrhosis. Now, there is treatment for that, and the main thing for fatty liver is if you lose 10% of your body weight and you get closer to your ideal body weight, in many cases it will reverse. Now, at the same time, the one recommendation is if you are drinking, stop for the time being at least, or permanently, because that can compound the fatty liver. and make it worse. And so I'm going to do a video on fatty liver because it's so doggone common in the Western world as well as in India now that people don't even recognize it. And they are starting to, particularly in the higher socioeconomic class, but even in the lower, it's causing issues. Someone asked about the perfect diet chart for a teenager. You know what? My pediatrician for our kids used to say, if they eat one meal a day, that's good enough, right? I don't think that's enough. It should depend on what they need, but I would say it has to be a balanced diet for the most part, and that you're hitting all the basic food groups and you're bringing everything together. The second thing is monitor their weight and, ultimately their developmental milestones and their performance can be affected if they're severely malnutritioned. But honestly, it's not very often that you're severely malnutritioned. And so it's in between. All right, you guys. So it's been an absolute pleasure talking to you. It's been almost an hour. And I hope this helped you. Do you guys have other things you want to discuss? Because what I was thinking is if you can leave the suggestions on any of my social feeds, Twitter, Instagram, or on this YouTube, we will save this and replay it. But I think the bottom line is that I'm here for you and you're here for me and we're all here for each other. And what I want to do is kind of make things very crystal clear and kind of get you thinking about your own health. And I'm not here to lecture you. I'm not here to make you feel bad or whatnot. I want you to feel great. You're beautiful people, and you take good care of yourselves and your families and your friends. I want you to have happiness, as you well should. So tell me what you want to hear about and what makes it easy for you. But I think at this point, I'm going to sign off. It sounds like you guys have even more questions, and you can write to me on drnene.com, or you can write to me on any of my Twitter feeds. It's been an absolute pleasure talking to you guys, and I look forward to the opportunity again. If there's anything else that you guys want to hear about, by all means, let me know. And at this point, I will sign off and catch up with you later. You take care, and you have a good evening, and enjoy the cricket match. And I don't care who you're rooting for, but root for playing together and sports, because I think they're so important. All right? Thanks so much.